Today. What's your name?
Arabella.
And when's your birthday?
November 22nd.
November 22nd? Awesome. So I have some equipment with me today. And I have my stethoscope, I have my watch, and I have a pin light. And I bought some equipment for you too. I brought you a stethoscope just for you. And I'm going to perform some hand hygiene so we can start with our assessment today, okay?
Cool.
Yes. So the first thing I'm going to do is look at your chest. Can you sit up for me? You can keep your head down. So when I'm looking at your chest, I can feel that the anterior to posterior ratio is 1:2 and that it is not bigger than the lateral view. All right, I'm going to put your hand down. Is it okay if I lift up your shirt? All right. So while I'm looking at your chest and I'm watching her breathe, I can see that she's not using any accessory muscles to breathe and she's being a little goofy. I can see the contour of her breasts and that they're equal bilaterally and that there's no lesions present. All right, I'm going to put your shirt down. The next thing I'm going to do is listen to her breath sounds. So on your stethoscope, you have a diaphragm and a bell. I'm going to be using the diaphragm of my stethoscope to listen to your breath, okay?
And then when you finish with that, then it will be my turn.
That's right. So I'm going to need you to be quiet. And I'm going to actually take her respiratory rate for 1 full minute. All right. Her respiratory rate was 21 breaths. Now we're actually going to listen to breath sounds. All right, put your stethoscope in.
Okay.
All right, I'm going to do it first and you can do it, okay? First, I'm going to be listening to her bronchial sounds near her trachea. Can you hold up your neck for me? Can you take a deep breath? In through your nose and out through your mouth. Again. 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 All right, and now I'm going to be listening to the bronchiovesicular sounds. Can you put your hands on your lap? Thank you. Deep breath. Deep breath. Let it out. Deep breath. Let it out. Deep breath. Let it out. And now I'll be listening to her vesicular breath sounds. Deep breath. Let it out. 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 Bella, in through your nose, out through your mouth. Deep breath. Let it out. Good. Now, because her right side has 3 lobes to her lungs, I'm going to be listening for the 3 locations for her breath sounds. Deep breath. It's all right. Deep breath. Out. In. Out. In. Out. And on the left side, she only has 2 lobes, so I'll be listening to her breath sound on 2 spots. Can you move your hand? Thank you. Deep breath. Out. Deep breath. Out. Wow, you're such a great job. So there were no adventitious breath sounds heard. In all her lobes, she had clear breath sounds. Now we're going to be listening to her heart sounds. Where's your heart? Is it there really? Do you have a big heart or a small heart? Big heart. Yes, you do. All right, I'm going to listen to your your heart sounds now, okay? It goes like this. Lub-dub, lub-dub, lub-dub. Okay?
No, it goes beep, beep.
Oh, maybe. All right. So first, I'm going to listen to her aortic heart sound, and that's going to be located one rib length down. Hey, can I move this off your neck for a second?
No.
Thank you. And then I'm going to just go on to the neck, slide right across to listen to her pulmonic heart sound. I'm going to go down 1 clavicular space and listen to her Erb's point. I'm going to go down 2 clavicular spaces and listen to her tricuspid. And at the 5th midclavicular line, I'm going to listen to her apical pulse, also known as the mitral heart sound, for 1 full minute.
Mommy, I love you.
Shh. Her heart rate was 102 beats per minute. Next, I'm going to check her pulses. We're going to begin by checking her brachial pulses located in her antecubital space, and we're going to check both at the same time. Let me hold this for you. Can you put your arms out? All right, relax. Brachial pulses are +2 bilaterally. And now I'm going to check her radial pulse. Can I see your hands? Palms up. Thank you. Brachial pulse is +2 bilaterally. Brachial. Next, I'm going to check your pedal pulse. Can you put your leg up for me? Thank you. So to check that, I'm going to go between her first big toe and her second toe and slide up until I feel a small notch and palpate. Good. And I'm going to do the same for the next foot. Bring it up. Put your toes down. Thank you. Pedal pulses are +2 bilaterally. Next, I'm going to check her post-tibial pulse, and I'm going to just slide my hand around her ankle and find that notch and palpate. post-tibial pulses are +2 bilaterally. And while I'm down here, I'm also going to check for edema. And I'm just going to slide up her leg and palpate. No edema present.
No edema present.
Yep, no edema. That means you have no swelling in your legs. Now I'm going to have the patient turn. Take a seat. And you can put your legs across. Sit up, please. Thank you. And now we're going to do something that's a little fun. It's going to help me check for the vibrations in your lungs. And so I'm going to have you sit up straight. Okay? And I want you to say 99.
99.
Good. 99. Say it again.
99.
Very good. Vibrations are equal on both sides. And now I'm going to check her chest expansion. And I'm going to be doing that by taking my hands and wrapping it around her upper waist with my thumbs touching. And I'm going to have her take a deep breath to see how far my thumbs spread apart. Regular. Put your head forward. Regular deep breath in through the nose and out through your mouth. Again. Okay, thank you. Chest excursion was approximately 0.5 to 1 centimeters. Now I'm going to listen to her breath sounds posteriorly. Okay. On the top will be her bronchiovesicular sounds. Deep breath in through the nose, out through the mouth. Deep breath. Awesome. Bronchiovesicular sounds were heard here, and vesicular sounds were heard at her lower bases. Now, the last thing we're going to do is to check her carotids. So I'm going to turn you back around. Hi. So my hands are going to be touching your neck. Is that okay? All right. Can you lift up your head? So first, I want to make sure that I'm palpating the carotids one at a time. So the first, can you relax? Put your head up, Relax. All right, and now I'm going to palpate the other side. Same thing, head up. Very good. Carotid pulses are +2 bilaterally, and I'm also going to listen to the carotid. And for that, I will be using the bell of my stethoscope. All right, can you put your neck up?
Neck.
Yep, put it up. Thank you. All right. Take a deep breath. Hold it. All right, breathe normally. Take a deep breath. Hold it. All right, breathe normally. Very good. No bruits heard. Lastly, I'm going to look at her neck for any jugular vein distension. Can you put your head back a little? Oh, just a little bit. So using my pin light, I can see that her, put your neck back, just your neck. I don't need your mouth. Close your mouth. Thank you. I can see that her veins are flat and that there's no protruding. And on the other side, it's the same. All right, you are an awesome patient. Would you like to hold my pin light? There you go. So health teachings I would provide for the parent and the child are first, the importance of hand hygiene because we are in the flu season. So we want to teach the child and the parent the appropriate technique and amount of time used to wash their hands. Secondly would be helmet safety. Do you ride a bike?
A new bike?
Yeah, do you have a bike?
Yes, I got a new bike.
And do you wear a helmet when you're on your bike?
Not for now.
Not for now. Well, that would identify a teaching point that she should have. We should teach the parents how to measure the head, and when choosing a helmet, being able to determine if the helmet was a right and appropriate size for the patient. Another teaching need that would be appropriate for this child would be diet. She is almost 4 years old and she's a very active child. So ensuring that the parents understood that she might not sit for an entire meal, but healthy snacks are just as equally important for her to get all the energy that she needs. Next teaching need for her would be the amount of sleep that she could have. So at this age, this child should have about 8 to 10 hours of sleep, and that does include nap time as well. For the breast exam, if she was an older adult, that would be appropriate for this time. I would first assess if the patient knew what a self-breast exam was, and if they regularly performed it. Depending if they said yes or no, if the answer was yes, I would ask the patient to demonstrate to me the technique that they would use, and if the answer was no, I would then take this time to teach the patient. So assuming that the patient would have said no, I would first teach the patient to perform hand hygiene, washing their hands and warming them up because they would be palpating their breasts. Next, I would have the patient remove their outer clothing and their undergarments as well and notify them that the first step is inspection, and this will be taking place in front of a mirror. During inspection, we want our patients to note the size, the symmetry, if there's any redness of their breast, any dimpling, or if there's any puckering or inverted nipples. This is done with two positions. The patient can put their hands on their hips and make sure that they're standing up straight in order to have the breast present in the most viewable position, and also putting their hands above their head and holding their arms up. Next, with their hands still on their waist, they can lean forward, and we want the breast to fall down so that she can assess the weight of her breast, seeing if one might be heavier than the other. Next step will be palpation. I want to teach the patient that she's using the pad of her fingers and not her fingertips. This is because 3 different pressures will be used while palpating the breast: light, medium, and firm. Light pressure is used to feel tissues that's right under the skin. Medium goes a little deeper into the tissues, and firm is when she's palpating closer to her chest and ribs. With that in mind, I would teach her that she would be using a circular motion starting from the nipple and going outward, around and around, using all 3 pressures. So she will be doing this 3 separate times. It's also important for the patient to note that she needs to be going into the tail tissue of the breast, known as the tail of Spence, and this is because lymph nodes are present here and they may be enlarged at the time. It's important for the patient to know another position that all this can be taking place is laying down with her arm above, raised behind her back, and using the opposite hand to palpate that breast because this lifts the tissue up and allows more surface to be covered during the time. Palpation can happen out of the shower or in the shower. Many women prefer inside the shower just to have that extra moisture and slip when palpating. It's important to tell the patient that they need to report any nodules, any lumps that they may feel while doing this breast exam to their healthcare provider, and also to choose a date the same time of every month to do this so that the results remain accurate. Also important when choosing a date is making sure that it is a couple days after their period because breast changes do occur before their period comes. After this, I would ask the patient if they had any questions for me or not, and I'd take this time to document. Thank you so much.